Tweets ignite society. Statuses begin battles. Everyone has an opinion. No one wants to surrender. We bring the cold hard facts. We are calling for a ceasefire.
The U.S. Food and Drug Administration issued a change to their emergency use authorization for monoclonal antibody treatments. So we're going to take a look at those today, as well as comparison for the adverse events that have been recorded in the FDA, as well as the World Health Organization databases. So to start off with, here is the U.S. Food and Drug Administration's letter to Eli Lilly and Company, who manufacture one of the monoclonal antibody treatments. In this letter, they indicate that the change will be in certain geographical regions. And you can go ahead and read through this. I'll provide all the links below. Down further, they indicate their scope of authorization as to when and when it cannot be used. You'll note that it says that it cannot be used in patients 2 years of age or older who are hospitalized. It's not authorized for use in patients regardless of age who require oxygen therapy. It's not authorized for treatment of mild to moderate COVID in regional areas. And again, like I said, you can go down through this. It's kind of interesting because by the time you get to the end, the question becomes when can it be used? But it's not authorized for post-exposure prophylactics based on some things. Not intended to be a substitute for vaccination, and it's not authorized for pre-exposure prophylactics. On the same day, the FDA authorized remdesivir for certain non-hospitalized patients, new at-home tests for COVID-19. Prior to this, you were only allowed to have remdesivir if you were in the hospital, but it now includes non-hospitalized patients age 12 and older who test positive. And again, I'll provide this link as well. So we're also going to look at the World Health Organization's adverse reaction database. It's worth noting that they have recommended against the use of remdesivir in COVID-19 patients. Again, you can take a look at all of those. Alright, well, let's dive into the Food and Drug Administration's Adverse Events Reporting System. You'll note this is the main home page. This tells you that this has been updated as of September 30th, 2021. So the next time it would be updated would be sometime in March, which would update up through December. So the first thing we're gonna search for is we will look for the one drug that came out in the very beginning and no one was allowed to use. Wait on the database. You can see that this particular one has been used since 2008. There's been an increase in usage, which increased the number of reported events. You can see up here there's been a total of 1,772 events. Again, that's since 2008 of death. And you can see that there's been 6,800 events this year in 2021. If you go over to here, it will show us the reactions that have happened. So it's just basically uncomfortableness, rheumatoid arthritis, pain, joint swelling. 2,300 times it didn't work. It doesn't say what they were using the treatment for, it just tells you that it didn't work, so people will report that. You can also break it down by product name. This one is all generic, so So let's head back over here and let's look at the next one that tends to create problems when you mention it. Let's go back to by year. You can see this one has been in use since 2008. You can also see it's only had 268 total in 2021. You can also see that in all these years, it's only had 393 deaths. You can also note the number of incidents that have been reported. We'll go over here to the reaction to see what type the reactions are. Again, this one would be a kind of a major reaction. Okay. Let's see. Product name. Let's see the different types or the different brands and the number of times they've been reported. And this is the most often used one, that's why it's so high. And you go there and you can see what the name of this one is. Okay. Now let's go to next one. This is the recommended one by the FDA. It's the one that's not recommended by the World Health Organization. You can see that it's only been in use for 2 years, 4,500 incidents. This year, 1,900 incidents. If you look at the type of reactions that they're having, some of these are kind of major, like this one. You might also note the number up here. And if we go to the product name, this is the name of the product. And of course, here's the generic name. And if you haven't noticed, I'm just not mentioning these names so I don't get tagged. And you can look at this stuff by yourself if you want later on. Again, I'll provide all the links in the description below. The change today was to the monoclonal antibody treatments, and there are 2 that they specifically named, and one is this one. So let's take a look at it. This one is new this year. It's had 193 events registered, only 2 deaths. The types of reactions that you have, kind of more discomfortable ones. Here's the product name. It's generic. And here's the generic. And the other one that was named is this one. You can see it was used a little bit last year. 1,800 adverse reactions, 54 deaths. What are the reactions? You can look down through here and see the types of reactions that you have. Kind of just more of a uncomfortableness. If you remember what we saw on the one that's recommended, this was one of the things listed here. It hasn't been listed on any of the others. It's only listed on that one. Okay. Now let's hop on over and take a look at the World Health Organization's database. This one is for this particular drug. You can look here and get an idea of adverse reactions for it. Let's see if we can, I think it breaks it down even further for you. So you can really find out a lot in this database. We can also see what countries have been using it and who's been using it the most. We can see how many years it's been on the market Notice that? Right? This is this one. And it's been used since 1968. And it's had this many adverse reactions, 33,000. And this year has been 3,700. Okay. The next one we looked at was this one. And if you look at here are the type of adverse reactions that they're recording. And these are the countries that use it. And again, notice it's been on the market since 1992. And this is the number of reactions we've had this year. And this is the total number, total, since 1992. We might bring that back to your attention again in a minute. Here are the monoclonal antibodies that were mentioned. Here's the adverse reactions that have been happening. Here's where it's being used. And here's the number. This year, 4,300, 4,400 total. In the 2 years, 4,400 total. Let's go to this one. This is the other monoclonal antibody. These are the types of reactions that are being had. Here's where it's being used. And 325 this year, one last year. So a total of 328. 328. This is the United States' recommended treatment by the FDA. Here's the type of things that have been happening for it. Here's where it's being used. And here's the adverse reactions. 2,800 this year, 5,000 last year, for a total of 8,000. Okay? And of course, this is one of the main things that everyone is recommended to do. Let's look at that one. Adverse reactions. Some of these numbers, note these numbers, right? This is the World Health Organization. This is where it's being distributed. And here's the adverse reactions for the current year. Now, of course, there's a higher number of people receiving this. And you can just kind of ignore that. That was more or less testing on some things. You might find that interesting since 2014. Note, this is not 28,000. And this is not 30,000. This is 3,060,465. Let's run back down through these. So this has generally been used for 2 years, and it has 3 million adverse reactions. This has been used for 2 years, and it has 8,000 adverse reactions. This has been used for generally 1 year and has 328. This has been used for generally 1 year and has 4,400. This has been used since 1992 and has 5,800. And this has been used since 1968 and has 33,000. So that should give you an idea. This is not recommended. This is not recommended. This has limited recommendation. This has limited recommendation. This is the number one go-to recommended. And this is the number one go-to recommended. Again, I'll provide all the links below because all we're here to do is provide the facts and allow you to make your own decisions. Thank you for joining us for this ceasefire moment.